Our research came about because we were interested to see how our patients with lymphocytic leukemia, which is the commonest type of leukemia in Western society, respond to the current COVID-19 vaccinations compared to the general population. We know that patients with blood cancer in general are at the highest risk of severe COVID-19 disease, and responses to other types of vaccination historically are known to be reduced. This is often because of the disease itself, or it can be because of the types of therapies that we use to treat the underlying condition. Our study is one of the largest studies ever conducted in patients with leukemia, examining vaccination responses. And we were able to show that around a third of patients after 2 doses of the COVID-19 vaccination failed to develop a detectable antibody response. And this compared to around 100% in our healthy donor controls. Furthermore, amongst those participants who were able to develop an antibody response, we found here that the actual level of the response was around 70% lower than that seen in our control population. So the magnitude or the strength of the response was also reduced. This is an important finding because when we tested the patient blood against live COVID-19 virus in the lab, we were able to see that there was a marked reduction in the ability of the patient's blood to neutralise the now dominant Delta variant. Neutralisation assays in the lab give us the closest indication as to how patients are likely to handle the virus should they be exposed to it in the community. So it suggests that our patients are still at ongoing risk and susceptibility to catching the virus, despite having had 2 doses of the COVID-19 vaccination. Studies that we've been doing in the laboratory here have really contributed to the JCVI, so the Joint Committee of Vaccination and Immunisation's decision to introduce a third primary dose of vaccine for patients that are immunosuppressed and susceptible to poor antibody response following the 2 initial doses of vaccination. And it's likely that as well as this, additional measures are going to be needed in order to protect patients that are immunocompromised going forward. And this may be in the form of monoclonal antibody therapies that have been generated and developed against the spike antigen that sits on the surface of the COVID-19 virus.